Hi everyone, I'm Dr. Lin of Rehab and Physical Therapy, and we've got Joey's leg today. I want to talk about and I want to re-change some things that you know about ankle alphabets for certain strengthening or mobility exercises after ankle sprains. People use it for plantar fasciitis. We also like doing it for your knee, hip, and ankle because you know this is the bottom of the chain. But the most important thing is what we want to really focus on, and a lot of you at home don't understand, is when you have plantar fasciitis or things like that, there's muscles that are in front or on top of this that go and get bowed down, and the pressure, there's also a nerve, the plantar nerve, it also gets pressed on, the bones collapse. So what we want to do is, the reason that you have a nice arch, those who have a nice arch, there's intrinsic muscles that help push it up. So they're kind of like little pillars that are keeping it up. And so those are the muscles we really need to strengthen while we do the alphabet. So we're going to use Joey's leg here in a second, but we want you to explain that, and I wanted to explain that a little bit more clearly. That's why we're going to do something like this and a little bit differently. Alright, so we're going to use Joey's foot here, and what I want you all to know is you want to start here with your toes curled. A lot of times it's hard for those of you who can't use their deep flexors in their feet, so this is a good place to start. Remember, do this exercise at your own risk, and make sure you check with your therapist or your healthcare professional if this is a great exercise for you. But I generally like to start with it in plantar flexion or your foot totally straightened out. And so you see some ballerinas, they do this, and people that do dance really get into it. So some people just do circles, they do clockwise, counterclockwise, but we like to do alphabets. I like nice, big, congruent alphabets. So Joey's starting to do the A, and he's doing it. And what you see is he's shaking a little bit, and that's a lack of control that we want to avoid. So you're going to keep doing it until you start getting things more fluid. It should be very concentric, very symmetrical. And that's what we're really trying to do. So he's got some work cut out for him here. But you want to see that you can keep this flex. So you're going to notice a couple things. You're going to notice that your foot is probably going to cramp, like those deep cramps, a little Charlie horse. You want to go through that. That's a normal thing. So just make sure it's okay for you. Sometimes just because of weakness that it wants to cramp. So that's a different theory of a way to look at cramping, and maybe it's a little bit more of a weakness and causes a spasm. But you'll find that if you're doing this better and better, and Joey's starting to get better as he does this, that it's smoother. That's one. And then number two is that the cramping happens less and less intense, or even later down the alphabet. So and so you can see that the dynamic ability to spell the alphabet is pretty good. Then the next progression is to actually do it with your foot flexed here, and then your toes curled again, and do the alphabet once again. So smaller range up here, you're not going to get as much because this is in what we call the closed pack position. Ideally you want the knee to be straight. You could do this like sitting, and you could do this in your office as well as laying on your back. So this is a great exercise to start getting that arch better, getting away from plantar fasciitis, and so yeah, that's where we'll conclude. Well, there you have it. Thanks for Joey for being our little subject here, and remember, this is a great exercise for those of you who are having trouble even walking in pumps, heels, flats, going upstairs, that knee stability, hip stability. Just remember this bottom of the chain, and the knee does get affected. Also, those of you who are having those foot cramps often, plantar fasciitis, even nighttime pain. So these muscles are really important to get stronger, and that's what we really want to do. So thanks again. If you like what we're doing, every Monday and Thursday we're pushing out new videos. We got some exciting stuff for you all to watch. Please subscribe if you're new, leave a like, and leave a comment if you have any questions as well, and we'll try to get back to you as soon as possible about that. So once again, I'm Dr. Lin, this is Joey. Remember, we can and we will get better together.